Hello and welcome to Beyond the Grafts. I'm Dr. Mark Tam, hair transplant doctor. Today we have a special guest, Dr. Salinda Johnson. Welcome.
Hello.
Okay, well, thanks, Dr. Salinda, to join us today. Dr. Salinda has many years of experience in aesthetic medicine. We're going to talk a little bit about non-surgical treatment and how that works with patients who are considering anti-hair loss treatment there. So, Dr. Salinda, please tell us a little bit about different non-surgical treatment that some of the guys can consider.
Yes. Nowadays, there are range of treatments, non-surgically, to help improve hair loss problem, of course. The popular thing in the trend at the moment is the platelet-rich plasma treatment, polynucleotide, and exosome treatments for hair loss.
Okay. So I've heard about PRP, but the other two is a little bit unfamiliar. But let's talk a little bit. Which one is the longest, been around for longest?
I think polynucleotide, longest probably PRP, of course. Polynucleotide and exosome in the past 2-3 years. Yes.
Oh, okay, cool. Well, since it's new stuff, let's talk about the new stuff. So tell us a bit polynucleotide. What was polynucleotide? What about mouthful that?
What is it? It's true. Polynucleotide is actually a fragment of DNA.
Okay.
Yes.
Cool.
So it's they produce it from believe it or not, it's salmon sperm.
Oh wow! They'll have a job to collecting. Okay.
Anyway, it's highly purified.
All right. Okay.
Fraction of DNA.
Uh-huh.
So what they do is they main thing is they help improve the blood supply into the hair follicles and anti-inflammatory. So it help improve the scalp condition as well. And then also it help activate the cell around hair follicle, which is dermopapilla, to activate them to help about growth of the hair.
Nice. So this is like a injection, right?
Yes, the treatment is an injection, and the protocol is we do every 2 to 4 weeks for about 4 to 6 sessions. But after that you have to do maintenance every 3 to 4 months.
Is it painful?
No,
It's okay.
You are the person who recommend me how to manage the pain on the scalp.
Yes, the different style of injecting and things. So thanks. Remember that, Selena. So this polynucleotide, what is it like? Is it like a fluidy thing, or is that like a cloudy, or how does it look like, that thing?
Yeah, it come in a pre-filled syringe. It looks like a clear gel.
Oh, like a gel.
Correct.
Oh,
yes,
cool.
Yes.
And then you inject that onto the scalp, and it will just work there.
Yes, so it's just a tiny injection spreading around the area. Right.
Cool. Does it bleed afterwards, or no?
Very little. Very little. I mean, it's no downtime. It's no risk at all.
So these guys can come and have this done and back to work, and probably no one would realize that.
No.
Oh, awesome. Cool. This sounds somewhat a little bit like PRP treatment without the taking the blood the part of it, is it?
It's kind of similar function because it help improve the blood flow into the hair follicle.
Nice.
But the polynucleotide will help also improve the scalp condition.
Okay.
Right, and so that is a bit better.
Nice.
However, the better one is exosome.
Okay, tell us about exosome. Let me just.
To me, it's like a PRP plus polynucleotide on steroid.
Really? Sounds too good to be true. Tell us about exosome. What was it? What is exosome?
So exosome is obviously come from stem cell. Yes. So the stem cell.
This time is not from salmon, is it?
No. Well, people take some stem cell from different sources.
Okay.
Of exosome could come from human.
Okay.
Which is like umbilical cord lining or amniotic fluid or fat tissue, adipose tissue. And then it could come from mammal, from animals.
Okay.
umbilical cord lining, things like that. And then from plant, nowadays they have synthetic exosome as well.
Synthetic exosome.
Yes.
Oh wow, that sounds a bit unreal, right? What is exosome? I've heard a little bit in some of the conference, and is this what is the intracellular, how they communicate, or the like signaling?
In the easy way to explain is, stem cell, they take stuff from something young, so they want to stem cell work by they sending the message to your cell to behave like them, like a younger person, right? So the message is inside a particle called exosome. The message is actually mRNA.
mRNA, okay.
Yeah, mRNA in exosome. So now instead of using stem cell, we take the exosome out from stem cell because we know that what it actually works is exosome. So we don't need any other thing in the stem cell.
Oh.
And because when you use stem cell not come from your body, you could have risk of allergic reaction to other thing in the cell. So by taking exosome out of stem cells, so it reduces the risk of allergy.
So smart, right?
Yes.
So this exosome, is it kind of like a gel, or is that like a fluidity, or is that like a powder? Or how does
It
it work?
come as a powder, yes.
Okay.
Nowadays, when they started, it come in like a 5 billion exosome particles.
Sorry, did you say 5
billion exosome particles?
That is a lot.
Yes, nowadays they have 200 billion.
Really?
In 3 years.
It's not 200 billion injections, so you guys can relax a little. In one syringe, right?
It's come in 2 vials, so 1 vial of exosome particles, and another vial we have hyaluronic acid, growth factor. Even nowadays, they mix polynucleotide inside this.
Inside the exosome as well? Oh, wow.
And then we have to mix this gel of hyaluronic acid, growth factor, polynucleotide mixed within exosome together. And then we use mesotherapy injection or microneedling and applied it on top of it.
Oh. So again, share a little bit of a similarity of sort of a low downtime and relative. Is it something that we need to repeat regularly as well?
Yes. So downtime wise, the treatment is similar. 3 of them: PRP, polynucleotide, exosome, just tiny injection to the area, or microneedling and applied it on. Some people combine with microneedling radio frequency treatment as well. On the
Microneedling radio frequency plus the exosome, or
plus 3 of them.
Oh wow!
If you want to.
It sounds a bit high maintenance, is it or no?
But usually the most effective one, I would say, just a tiny injection we call mesotherapy injection to the area, which doesn't have really any downtime, no real side effect or anything like that. And then exosome is quite similar to polynucleotide in the way that you have to do quite a few sessions. Talk about 3 to 6 sessions. And then after that, you have to do maintenance every 3-4 months, or maximum 6 months.
And how does exosome? So exosome is more like on a PRP and polynucleotide and steroids.
Does it work? Because the exosome has function to do all of that. It's about healing after hair transplant. Very good.
Yeah, we need this on this.
And it's increased the blood supply to the area, so it's produced a new blood vessel around the hair follicle. It's activate dermopapilar cell around hair follicle that regulate hair growth. And it's also extend the anagen phase, the growth phase of the hair as well. So it has a lot more things because, as I say, it has growth factor as well, and you add polynucleotide in it as well. So you basically have everything in it. So
does that mean we don't need consider doing PRP? Because PRP has been around for a while now. So PRP, where it's been the mainstay for non-surgical treatment, so non-transplant, non-medications, non-surgical treatment for quite a while. Now that with polynucleotide and exosome, do you think do you think next time we don't need to consider doing PRP or replace that or?
I would say PRP is I mean it's pros and cons. PRP is good that it's from yourself, right? From the patient's own blood. So it's really and no risk basically, allergy or anything like that. Although polynucleotide and exosome I haven't seen anyone allergic to them. And but in terms of quality-wise, PRP is depend on the number of platelet of patients as well, right? So we don't know how much in there, whereas polynucleotide and exosome, they're all measuring already in the bottle, so you know what it is in there. So obviously, the result, I'm sure, is much better than PRP on its own, yes.
So if someone is considered, maybe they had already been, let's say, some patients of mine who've been on minoxidil or other anti-Hairloss medications, considering non-surgical treatment, what would you suggest?
I would say if they are young, starting to have hair loss, I would say the PRP and polynucleotide is good for them.
Okay.
And it's not so expensive.
Okay.
Yeah. But exosome is a bit more expensive treatment. As you know, it's come from stem cell. It's quite complicated to make it. So they're more expensive. But it can treat any type of hair loss, including even alopecia areata. Whereas PRP and polynucleotide, I would say probably not suitable for that. Whereas exosome is more versatile.
Oh, okay. And then number of treatment, does that vary? Does one need a little bit more compared to the other, more frequent or less frequent? Which one? Are they a similar sort of schedule?
Quite similar, yeah. But obviously, if you have more severe hair loss problem, we probably do more session at the beginning. Then people who have less hair loss problem.
Oh, okay. So younger patients, maybe PRP, polynucleotide, and more mature patients, maybe exosome, polynucleotide, that sort of directions.
That's right, yeah.
Cool. And in terms of how that intervene with the other treatment, let's say if someone just had a transplant, do we need to wait for a while before all this treatment? Because I think with some doctors like to do it immediately afterwards. Some like to do it a little bit space out a little. Is that a time frame where the will be too soon to do exosome or too soon to do polynucleotide?
Actually, it should come from you. I always think probably I would leave it for the graft to take, right? Maybe 1 month.
Yeah. I think that's a good amount of time of healing. Sometimes I think I'm just concerned it's a bit too soon. When you in old days when we had patients who went out elsewhere to have PRP, and I sometimes worry it's too soon when we do the if they were to do the injections too firmly, when they inject too hard, sometimes the grafts can pop or something if they're done it within a few days after the transplant.
Yeah. But as I say, it helps about the healing and anti-inflammatory. So it might be good to have the treatment before the hair transplant.
Just to get ready. Just
to get ready. It could be like 2-3 weeks before, and then do the hair transplants, and then another session, maybe another 4 to 6 weeks after.
Do you get swollen afterwards with all these injections afterwards?
On the scalp, you can't really swell that much. And you can't really see much
Yeah.
in that area. Yeah.
Cool. And how about those areas that so we focus a lot on areas, let's say is receding in the hairline or the area we transplant. How about areas sort of further back in the crown or even in the donor where we took the hair from in the back? Let's say sometimes we need to take a lot of hair from the back there. Those treatment can apply to let's say the donor area as well.
Oh, that's a good question because we always think about where it has been transplanted. Yes, you can apply everywhere. Yeah. It should help about the healing.
Because we took from the back, so sometimes there is a bit of inflammation in the area. There might be a little bit very miniature scarring in the back, and there may be some areas if we want them to have a little bit of regrowth. And if we can do that, then I think it's an amazing thing.
Yeah, that's a good question, but we usually can apply everywhere.
Okay, cool. So we actually had a few patients of mine who had transplant, and Dr. Salinda looks after that. So we'll have a look on we'll show it a little bit on screen in here on how the result looks like, but we are going to talk a little bit about other things. Is there anything we want to talk about, Salinda?
What else? Yes, so this treatment, the PRP, polynucleotide or exosome, obviously, apart from put on the hair, on the scalp, we can apply almost everywhere on the skin for cosmetic.
You can do it on the face.
Yes, face, common area, obviously, face, neck. Yeah, you can use on the back of the hands, or you can use this treatment combined with machine, as I say, the microneedling radio frequency, therapy, any skin tightening or anything to help stimulate collagen production.
You mean for those radio frequency for in the hair as well?
Yes, people do, but not high. It's quite a low level radio frequency. Yeah, the microneedling. So
it combine.
Yeah, so nowadays there's a machine like Morpheus 8 or lots of different machines that it has a needle that you could go through your skin, maybe 24, 40 micro needles.
Okay.
And then at the tip of the needle, it releases the radio frequency, which is a little bit of
It's
heat.
like energy.
Energy, yes, give you a little bit of heat to stimulate collagen production. Yeah, so you got double act.
It's kind of help with the hair.
Yes. Yeah. It's really good result when you combine that.
Oh, cool. Sounds very painful, is it?
Yes, slightly.
And so you just so there's like a probe or something, and then you like a micro needle that sticks out, right? And you put it on, and then you press the machine, and then
Correct.
it just do you feel the warmth or something, or
You feel like something like a stump.
okay, yeah,
like a stump, and feel a little bit warm, like a little prick, things like that.
like for how long? Like a few seconds or something, or you go?
You just go around the area.
Okay, so you
but
just
because it's quite low level energy, so they're not too bad.
oh, okay, and like dude. I'm just imagining. I haven't seen it before. Okay, and that can also combine with the treatment. Let's say exosome and polynucleotide. We talk about. You put some.
You put in the same session. You can do that.
Oh wow, that's sort of a multi-factor sort of direction targeting different ways. Huh?
Yes. So to summary, I would say that this treatment is good for someone who start to have a problem with the hair loss. I'm talking about from hormone or different problem. You can any kind of hair loss cause you can use this. But for androgenic alopecia, the earlier the better.
Well, if someone is like quite advanced, like a Norwood 6 or 7, who's just totally shiny and no hair at all, would that kind of help? Or does it work?
Probably definitely not PRP and polynucleotide, but in exosome, people are still trying at the moment. Yeah,
Okay.
but it's not. To be honest, not many study about that yet, so I can't say anything much. as well.
So the earlier it is, the better it is to protect the future hair loss.
Correct, yeah, because if you don't want to go on minoxidil or finasteride yet, or you don't consider that choice, this could be a good choice.
Beautiful, beautiful. Good. Well, that's really informative, and thanks for the detailed info. So if anyone needs any help with non-surgical treatment, you can contact Dr. Salinda Johnson.
The London Cosmetic Clinic, number 4, Harley Street, yes.
Beautiful. Thank you so much, Linda. Great to have you in here. Thank you.
Thank you for having me.
Thank you.